My name's Fiona Long, and I'm currently in post as an Assistant Director of Nursing for Sussex Community NHS Foundation Trust. The Trust spans most of Sussex and incorporates adult services as well as children's and specialist services. I started my career in nursing 33 years ago, and I haven't looked back since. I've been so privileged to have held so many varied roles since then. My roles include acute surgery, nursing, A&E and high dependency. I've also worked in specialist practice in infection control, as well as more corporate roles with risk management and safety. I've also spent a number of years working and leading occupational health services in Sussex, and was the first to develop MDT working, and one of the very first to receive CQOS accreditation, which is really the equivalent of CQC for occupational health services. Most recently, I have been deployed to lead on the clinical workforce and clinical safety elements for the COVID mass vaccination centres. I have to say this has been one of my biggest challenges yet. It's also been one of the most rewarding challenges. I shall never forget the first day we opened in the biggest centre in Sussex and seeing so many frail elderly people desperate to come and get their vaccine and coming in taxis and on various modes of transport just to ensure they received that first dose. After I qualified as a nurse, I continued my studies, and I have qualifications at degree and master's level. I also hold NMC registration on Part 1 and Part 3 of the register. In addition to these qualifications, I've also continued to learn through various individual modules and other courses on leadership and management. One of my career aspirations was to apply and be successful in becoming a Florence Nightingale Scholar. I've held this vision for a number of years, following a conversation with a mentor I had who had also completed the course. I was absolutely overwhelmed to be awarded a place on the course, because I know how difficult and how important it was to me to get this place. I do recall on the first day of the first cohort, hearing that within 2 years of starting the scholarship, it is usual for scholars to move into a more senior role. I wondered if this would ever happen to me. However, within 6 months, I had achieved this. I'd accepted a post which was an 18-month secondment, a strategic nursing workforce lead for our system in Sussex. I reflected on my interview, and I definitely owed my interview success to the techniques I learnt on my 3-day residential at RADA. There have been many standout moments for me during the course, but I think the most memorable and most impactful have been during and following the Windsor Leadership course. This course has such a unique delivery, and the learning is so subtle, it's quite hard to articulate exactly how this happens. But I think mostly it allows you to be you and to enable the development of yourself in a safe environment. And it's taught me that it's okay to be different and to think differently. As part of our scholarship, we were asked to look at an improvement project. Something that's passionate to me is nurse education. And part of my current role also includes leading on the professional development of adult nursing within the organisation, practice education and the funding panel, which enables workforce education. I've also been involved with setting up a Sussex-wide consortium for training nursing associates. So this led me to thinking about the T-levels. The T-levels are new courses that follow on from GCSEs. So my project focuses really on the health science programme that's due to commence in this September. There was a small pilot course set up a couple of years ago, and it really was factored around the BTEC course with placements. So that, and the success of that really made me think the T-levels would be a great way to support local children into careers in a different way, rather than having to go to university into healthcare careers. T-levels are equivalent to 3 A-levels and are a 2-year course, but the main difference is the placement. They get 45 days of placement through those 2 years. I wanted to make sure that students wanting to do the healthcare science programme at T-level in Sussex had access to really good placement experience. So I put a paper together and had approval for a seconded post. I managed to second a nurse educator who also has a huge background in apprenticeships. We've set up a project board and a project plan to ensure that we have effective end-to-end management of this, to make sure that we can deliver on time for this September. The board itself reports into the Systems People Committee for governance purposes. To date, the project has moved really quickly, and we've got buy-in from all provider trusts in Sussex, as well as the local college groups that run the area colleges. Having everybody fully engaged is a key to success of this project. So far, this project is demonstrating true collaborative working. Traction is really gained because of this, and the project is on target to ensure that the health science T-level students entering the course this September will be provided with good placement experience, and this will really complement their college programme. As I mentioned, there was a pilot study in one of the colleges in Sussex in 2019. I don't have any data at the moment for my project. However, the data from the previous pilot showed that from the 12 students who incorporated placement into their course, we saw 4 of those students move into clinical apprenticeship posts. My feeling is that the impact of this QUIP will be twofold. It will enable an alternative route into healthcare professions for young children or young adults, and in particular the apprenticeships into nursing and allied health professional qualifications. It will also support the pipeline of careers into health, which in turn enables delivery of safe patient care, of which I'm very passionate about. The project will be continued until September to make sure that we keep traction on this and it's delivered in a timely and professional way. Following delivery of this, we will monitor every quarter for the first year. In terms of my Florence Nightingale Scholarship, I just want to say a huge thank you to Health Education Sussex. I feel so immensely privileged to have been chosen to study with the Foundation, and the learning has been an incredible journey for me. And I know this will definitely continue, particularly because as a group we've formed a great support network. And in particular, this has been really evident whilst we've all been working our way through the COVID pandemic. Rarely a week goes by without communication within the group.